In SLE, antibodies appear, how many years before onset of clinical features? 3 years. Guidelines for SLE diagnosis through ANA anti-nuclear antibody screening. If ANA positive, 1. Look for methodology ELISA or indirect immunofluorescence. 2. Titer greater than 1/80th. 3. Look for patterns. Which is the only accepted methodology for diagnosis SLE? Offer ANA positivity. Indirect immunofluorescence. Using Hep2 cell line, human epithelial 2. In Sjogren, antibodies appear, how many years before onset of clinical features? 10 to 15 YRS. Which pattern of ANA rules out CTD connective tissue disorders? Dense fine speckled pattern. In cells of meiotic phase. Only pattern in meiotic phase, rest all patterns are in interphase. Which pattern of ANA is suggestive of Sjogren? Fine speckled with anti-RO LA antibody. Which pattern of ANA is suggestive of SLE? Coarse speckled pattern with anti-Smith antibody. Homogeneous pattern with anti-dsDNA antibody. Which pattern of ANA is suggestive of drug-induced SLE? Homogeneous pattern with antihistone antibody. Which pattern of ANA is suggestive of CREST syndrome, scleroderma? Centromere pattern. Which pattern of ANA is suggestive of systemic sclerosis, SSC? Coarse speckled pattern with anti-RNA polymerase III antibody. Which pattern of ANA is suggestive of polymyositis, dermatomyositis? Cytoplasmic pattern with anti-Jo1 antibody. Which pattern of ANA is suggestive of polymyositis, scleroderma overlap? Nucleolar pattern with PM-SCL70 antibody. Which pattern of ANA is suggestive of MCTD, mixed connective tissue disease? Coarse speckled with anti-U1-RMP antibody. To confirm the antibodies, which 2 profiles are done in SLE? 1. ANA profile. 2. ENA profile. Done only once. How many percentage of SLE patients are ANA positive? 97%. Which disease has 100% of its patients ANA positive? 1. MCTD. 2. Drug-induced SLE. 3. Type 1 autoimmune hepatitis. How many percentage of Sjogren patients are ANA positive? 85%. How many percentage of IG4 disease patients are ANA positive? 50%. How many percentage of RA patients are ANA positive? ANA is not diagnostic in RA. Can a patient still have SLE if they are ANA negative? Yes, it's elderly postmenopausal SLE. ANA negative, anti-RO positive. Methodology to do anti-dsDNA antibody test in SLE. 1. Immunoblot, ANA profile. 2. ELISA. 3. Cryptidia lucilii flagella. Among anti-dsDNA and anti-Smith antibody, which one is more sensitive and specific? Anti-dsDNA, more sensitive. Anti-Smith, more specific. Among anti-dsDNA and anti-Smith antibody, which one tells about effect on prognosis? Anti-dsDNA. Its higher titer means higher risk of nephritis, vasculitis. Significance of anti-RO LA antibody in SLE. 1. Indicates secondary Sjogren. 2. In pregnancy, chances of congenital heart block. 3. Associated with subcutaneous cutaneous lupus. 4. Good prognosis. Antiphospholipid syndrome (APS) antibody is positive in how many % of SLE patients? 1/3. Significance of anti-RBC antibody in SLE. Warm antibody AIHA. Significance of antiplatelet antibody in SLE. Secondary ITP. Significance of antihistone antibody in SLE. Drug-induced SLE. Which antibody is specific for psychosis depression in CNS lupus? Anti-ribosomal LP antibody. Most common antibody in CNS lupus. Anti-glutamate, anti-neuronal antibody. Which antibody in SLE is associated with shrinking lung syndrome? Anti-RO-LA. What's most common CNS manifestation in lupus? Cognitive decline. What are markers for disease activity in SLE? Anti-dsDNA titer. Decreased C3, C4. High ESR with low CRP.